In this class, we are going to discuss what are the different types of oxygenators and different types of pumps are being used in hot lung machine. Okay, so first we will see what are the different types of oxygenators are there in hot lung machine. So the first one is membrane oxygenators, rotating disc oxygenators, bubble oxygenators, and capillary oxygenators. The membrane oxygenator is a device. It contains a thin membrane. So this membrane is going to separate the blood and gas. Okay, so the gas, which is nothing but oxygen rich gas, and the blood, which will flow on either direction. In these two will be separated by the membrane called thin membrane. So this thin membrane will act as a semi permeable membrane here. So it will enables the oxygenic, I mean gas exchange process. So the gas will diffused, that is oxygen will get diffused from the gas flow into the blood through the semi permeable membrane, that is a thin film membrane. Okay, so this through which the oxygenation process will be carried out. So oxygenate, and the main purpose of the oxygenator is to have a oxygenation process, that is the gas exchange mechanism. So through which the semi-permeable membrane or the oxygen rich gas from the gas flow will get diffused easily, that is from higher concentration into lower concentration. It will move from gas flow into the blood through this thin membrane. So these particular oxygenators will be used widely due to the efficiency and low resistance. This is all about membrane oxygenators. The second one is the bubble oxygenators. This is also one sort of oxygenators which is mainly used and commonly used in hot lung machine. But the thing is that here the gas flow, okay, that is oxygen will be sent into the setup through bubbles. Okay, so here the gas bubbles will be introduced into the blood. So the blood will get, the blood will absorb the oxygen as it flows around around the bubbles. Okay, so the bubbles, all the bubbles is being carried what oxygen, right? So whenever the blood passes through these bubbles, it will easily absorb the oxygen and easily removes the carbon dioxide. Small bubbles will the small bubbles carries the oxygen will get easily absorbed by the blood, and large bubbles will easily absorb the carbon dioxide from the blood. Okay, so through which the two gases will exchange, because the large bubbles have a large surface tension, so that the CO2 from the blood is gets removed, and small bubble have lower surface tension, so that the higher concentration of oxygen from the gas flow, from the bubbles, it goes into the blood. So this is through which the oxygen, the gas exchange process will take place. But this sort of bubble oxygenators is less common because it will induce or it will result in some embolism risk. Okay, some gas embolism or air embolism will be there, so it will end up with some other consequence. So that is the main one of the main drawback of bubble oxygenators. And fourth one is rotating disc oxygenators. Here we have a rotating disc. So this rotating disc will increase the surface area for having very good gas exchange process. So it will improve the oxygen efficiency. So it will absorb more oxygen compared to the other cases. That is one of the advantage of rotating disc oxygenators. So they will be using in situation like where the high blood flow rate is required. Okay, this is all about rotating disc oxygenators. Next one is capillary oxygenators. So here we have so many numbers of capillary tubes. This will since we have a more number of capillary tubes, it will increase the surface area as like rotating disc. So we have good amount of gas exchange process, that is O2 will goes into blood, and from from the blood, CO2 from the blood, it will goes into the capillary tube. So the oxygen diffusion process will take place. So this is known for low priming volume and reduce the hemolysis risk. Where whenever we are want to have a very minimal amount of blood volume to have a process of heart lung machine, then we have better option to go with capillary oxygenators, because it requires only very low priming volume compared to the other different types of oxygenators. Okay, So on the whole, if you take any different any types or any different kinds of oxygenators, the main mechanism or these four. The first one is gas exchange process. If you take any oxygenators like your rotating disc or bubbles or membrane or whatever it may be, the first and important mechanism is that gas exchange process. So the oxygenators use a principle called diffusion process through which the CO2 and O2 gas will get exchanged from higher concentration into lower concentration, or through pressure difference gradient will also move the molecules from one end to another end, that is higher end to lower end. And then we have flow dynamics, okay, because the design of oxygenators, okay, we were that could be any oxygenators which highly influence the blood flow, which will have very impact on oxygenation level and the efficiency. Because the flow dynamics is, if it is vary, then it will affect the oxygenation level and the efficiency of oxygenation process. Then we have to ensure the flow dynamics it is mimic the normal blood flow. And then we have a third, fourth, a third important mechanism of oxygenator is the surface area utilization. So the how much like as long as you are increase the surface area, your oxygenation process will also be high. So the various designs we has been introduced or implemented in order to maximize the surface area, so that it will enhance the gas exchange efficiency process. So last important mechanism of oxygenator is the temperature and pH control, because these the same oxygenator will have the setup of so many number of stainless steel tubings or stainless tube pipings through which the cold water or hot water will be flow through it, will be flow inside these steel like tubing. So these steel like tubing, whenever we are having blood in contact, through the heat conduction mechanism, the temperature of the blood will get varied. Okay, and also pH, because of addition of O2 and CO2, the concentration of uh, like uh, the gas concentration will also get vary. So this is the main, one of the main mechanism of oxygenators in addition to the other three. So first one is gas exchange process, second one is flow dynamics, and then we have surface area utilization, and fourth one is temperature and pH control. So what is the comparison of these oxygenators? Okay, we are going to compare this all different types of oxygenator in four characteristics. One is efficiency, and then risk factors. And third one is cost and maintenance, and fourth one is blood compatibility. If you talk about efficiency, okay, if you are talk about in terms of efficiency, the membrane oxygenator is it have a very good efficient in terms of gas exchange. At the same time it requires very less space, so the efficiency case the membrane oxygenator is very good compared to other three. And risk factors, if you see, you have bubble oxygenators will possess very high risk compared to other oxygenator, because in bubble oxygenators we are inducing the bubbles for oxidation process. In by chance if any bubbles is getting into the blood vessel, then it will end up with some miserable situation. So that is a case, it has high risk, so it is less desirable compared to the other different types of oxygenators. And the blood compatibility, you can have we have different oxygenators. It has a different levels of biocompatibility. So again, this blood compatibility is very important when we are designing the oxygenator, because anyway it is being attached with our body to since all the blood is again sent it back to the body for the further circulation. The blood compatibility factors we have to be um, look into very serious when we are designing the oxygen concentrator. So the all different oxygenators have different sort of different varying levels of biocompatibility. So without any compromise we have to look this particular characteristics. It will it will have very great impact on patient outcomes. And last one is the cost and the maintenance. So if you see the cost as well as the maintenance case, the capillary and rotating disc oxygenators will be more expensive, and it requires a careful maintenance compared to the other oxygenators. So the capillary and rotating disc, it is like it is not much affordable, and also we need a trained trained people or trained technicians in order to maintain this sort of oxygenators. So these are the comparison. We have made it for four characteristics for different types of oxygenators. Thank you.